Have you ever heard someone say, "Doctor, I took the emergency contraceptive, but still I'm pregnant"? And you ask the number of days, the person would say, around 4 days later. Hello everyone, welcome back to Better Health with Dr. Payne. Thank you, Efia. This is where we talk about health in a simple and practical way. And today we are concentrating on emergency contraceptives. Now let me ask you something. Have you ever heard someone say, "Doctor, I took the emergency contraceptive, but still I'm pregnant"? And you ask the number of days, the person would say, around 4 days later. Today, let's talk about some common mistakes people make when taking emergency contraceptives, especially the ones commonly used in Ghana. Because sometimes the pill is not the problem, the timing is. Common ones used in Ghana are Lydia Postpil, Postinor-2 and Levon 2. Today, we are going to talk about common mistakes people make, how these pills actually work, and why they cause side effects sometimes. And before we continue, if you enjoy health education like this, please like this video and subscribe to this channel so you don't miss our next episode. Now for mistake number 1, waiting too long. Emergency contraceptive pills work best if taken as soon as possible after unprotected sex, ideally within 24 hours. Can still work up to 72 hours, but the earlier you take them, the better they work. So if someone waits 3 to 4 days before taking the pill's job becomes harder. Timing is indeed everything. And if this is something you didn't know already, kindly give this video a like so that more people will know this information as well. Mistake number 2, using it like regular family planning. Another mistake I often see is people taking emergency pills like everyday contraception. In fact, some people take it several times in 1 month. That is not what it was designed for. Emergency pills are meant for unexpected situations, not everyday contraception. If someone is sexually active regularly, it's best to consider consistent contraceptive methods. Watch this video on contraceptives and what they didn't tell you. If you are learning something so far, please subscribe to Better Health with Dr. Payne for more simple health related information. Mistake number 3, we have incorrect dosing. Sometimes people don't follow instructions or mode d'emploi thoroughly. For example, some contraceptives require you taking 2 tablets at specific times. One dose is missed or taken incorrectly, it would affect its effectiveness. So always read the instructions carefully, or better still, ask your pharmacist on betterhealthwithdrpayne@gmail.com. Now let's look at how emergency contraceptive pills work. Do you know that emergency contraceptives contain a hormone called levonorgestrel? In simple terms, this hormone mainly works by delaying ovulation. Ovulation is when the ovary releases an egg. No egg equals no pregnancy. The pill basically presses the pause button on ovulation. So now let's compare emergency contraceptive pills with everyday contraception. There is something interesting. Come closer. Emergency contraceptives contain a higher dose of this hormone that we talked about as compared to this everyday contraception. This is why regular contraceptive pills are taken every day to gently control or regulate the menstrual cycle. Emergency pills, on the other hand, release a larger dose of this hormone to delay ovulation at once. Think of it like this. Regular or everyday contraceptive pills are like policemen who we see every day on the road, maintaining steady daily security. And emergency contraceptive pills are like calling the military when something unexpected happens. And if this video helped you understand it better, please share the link to someone who might also need this. Let's move on to why side effects happen. Because emergency contraceptives contain a higher hormone dose, some people may observe some side effects such as nausea, headache, breast tenderness, and changes in their menstrual cycle. This is because the body suddenly receives a strong hormonal signal which disrupts temporarily the body's hormonal cycle or normal frequency. But the good news is that these side effects are usually temporary and will resolve themselves in a few days. One important reminder is that emergency contraceptives or everyday contraceptive pills do not, I repeat, do not protect against sexually transmitted infections or STIs. Only condoms help reduce the risk of HIV/AIDS. You can watch this video on how many people have HIV/AIDS in Ghana and how you can protect yourself. So the main message is simple. Emergency contraceptives can be very effective, but their effectiveness depends on using them correctly. Take them early, follow the instructions carefully, and avoid using them as regular contraception. And also importantly, they do not protect against STIs. And whenever you are unsure, speak to a qualified healthcare professional like myself. You can contact me on BetterHealthwithDrPayne@gmail.com. If you found this video helpful, please like, share, and subscribe to Better Health with Dr. Payne and turn on the notification bell so you don't miss my next video. Because when we understand our health better, better health starts here. For more information on contraceptives, especially the regular pills, watch this video. Yeah, this one. See you in our next video and ciao.